Welcome to BW Healthcare World. My name is Harbinder Narula, and this is a podcast series which is focused on patient safety and quality in partnership with Kaho. On occasion of the Patient Safety Day, I have with me Dr. Tarang Gianchandani, who is the CEO of the Sir H.N. Reliance Foundation Hospital, and she's here to talk about why Patient Safety Day is important and what is the role of patient safety in diagnostics. So, welcome to BW Healthcare World, Dr. Tarang Gianchandani from Reliance Hospital. Welcome, Dr. Tarang, to BW Healthcare World. Thank you so much for joining us on this Patient Safety Day. Uh, Quickly, can you give us a small brief about the history of the Patient Safety Day? And what do you think, what is the purpose that this specific day serves today?
So I think the World Patient Safety Day is amongst the, as we all know, 11 global health campaigns which is sponsored by the World Health Organization. And this, why we celebrate World Patient Safety Day, it was established to celebrate this from May 2019, following the adoption of a resolution for global action on patient safety by the World Health Assembly. The initiative emerged from an annual Global Ministerial Summit on Patient Safety, which was initiated actually in 2016, driven by a robust advocacy and unwavering commitment from major international stakeholders. And the World Patient Safety Day, as it is observed on 17th of September, it aims to raise the global awareness about patient safety amongst all healthcare providers, and it actually calls for solidarity and a concerted action on behalf of everybody who is in the profession of providing healthcare, giving healthcare across the various countries and across the international partners in order to reduce the harm to the patient.
And Dr. Tarang, what is the theme for this year specifically?
So the theme for this year's Patient Safety Day is improving the diagnosis for patient safety with a slogan, get it right and make it safe, so that we can highlight the critical importance of the correct and timely diagnosis in ensuring patient safety and improving the health outcomes for the patients.
And Dr. Tarang, why do you think we need to focus on diagnosis? What is the importance of diagnosis when it comes to patient safety?
So I think the diagnosis for patient is the first step, which tells us what will be the outcome for the treatment of the patient. And it's like a program in which if you put the right input, then you get the right output. So likewise, a diagnosis identifies the patient's actual health condition. And to reach to the diagnosis, the patient and their healthcare teams, they all have to work together, navigate through the complex and sometimes lengthy diagnostic processes, come out with differential diagnosis, and finally come out with what is actually the problem with the patient, the diagnosis of the patient, and then come out with treatment options, and then finally communicating the result to the patient of the diagnostic, communicating to the patient what is actually the patient suffering from and what will be the treatment plan. So I think the diagnosis is the key. It is the key to open the lock towards the best of the patient care outcome.
Absolutely. I couldn't agree more with you, Dr. Tarang. Dr. Tarang, when it comes to diagnosis and we're talking about the patient safety, one of the objectives is also to reduce the diagnostic errors. Can you explain what are diagnostic errors that we refer to, and maybe what are the causes that lead to a diagnostic error?
So I think, as we all know, a diagnostic error in simple words is, a failure to establish an accurate and timely explanation of patient's health problem and communicate the same to the patient. So it has three components. One is it should be accurate. Second is the timely explanation, and most importantly is the communication part. So this part many times we miss, but it is very, very important. An accurate and timely diagnosis, which is communicated to the patient, presents the best opportunity for a good and a positive healthcare outcome for the patient, because the clinical decision making is tailored to the correct understanding of the patient's problem, as well as patient understanding his problem, so that he can also participate in the process of his treatment in the right way and with the right frame of mind. And any error in establishing this is basically an error which increases the chances of a patient towards non-accurate clinical outcomes and non-accurate clinical diagnosis, and may finally lead to patient harm. It has been actually seen that the magnitude of diagnostic errors is so much that it can at times be really responsible for 16% of preventable patient harms that can happen through the healthcare system. So a landmark Institute of Medicine report has found that despite of dramatic improvements in patient safety over last 15 years, diagnostic error still continue to be a critical blind spot for the healthcare providers. And the causes of these diagnostic errors are, there are many causes, but if I have to divide it, I would say there are human causes and there are system elements. The explosive growth which we see in the medical evidence and new technology, it's sometimes a double-edged sword, because we forget the basis on which a diagnosis is made, basis on which a diagnostic test is ordered. So what is this basis? What we were taught in our medical schools, that okay, when a patient comes to you, do a proper history taking for the patient, do a proper examination of the patient, then based on the two, plan the diagnostic test, analyze the test reports, see how it fits in with the presentation of the patient, and then come out with differential diagnosis, analyze each diagnosis, remove every differential to come to the final diagnosis, and then plan the treatment for the patient. What we do is that because of the new technologies, because of the new way the algorithms are available, we just forget that we have to take the history, we need to do clinical examination. It becomes, sometimes it can be very mechanical.
Mhm.
So that leads to error. So I think that's a part of the human factors. For also, it also depends on, like, there are so many laboratory tests, but the number of diseases that they can diagnose is much higher. So there will be like 10,000 known diseases and more than 3,500 diagnostic tests, but only a small number of symptoms in comparison. So the symptoms are very important to
Right.
put it in the whole gamut of affairs. And one symptom can actually be a reason for many of the diagnoses. So we need to put these three pieces together very carefully. The
Right.
healthcare systems, what why they are important is that they have to link these hundreds and thousands of different processes and practices, procedures, and technologies to coordinate in order for the doctor to arrive at the right conclusion. So while these systems are built with patient safety in mind, the sheer number of connections increase the risk of miscommunication and sometimes breakdowns along the way.
And Dr. Tarang, since you're talking about thousands of diseases, thousands of conditions, and 3,500 tests, have you found that medical errors or diagnostic errors are more associated to a certain kind of specialities more than the other?
Yes. So what we see is that, see, when we see the malpractices claim across all the specialities, it is seen that the number one causes of medical claims in a primary care discipline or and in emergency medicine and radiology, and most of the medical subspecialties are more prone to such errors. That's why the claims are higher in this. In surgical specialties also, there are higher number of claims because of lack of reaching to the right diagnosis, so you do a wrong surgery. But according to me, I think the most important reason where we have diagnostic errors is in the emergency setting, because the disease process is still evolving. So, for example, when a patient presents with the acidity and we just feel that it's an acidity, we just give pan 40 and the patient, and we expect the patient to be fine because our diagnosis is, uh, some indigestion or gastroesophageal reflux, but it could be an evolving MI. So at that point of the time, that point of care testing is very, very important to ensure that the person uses his acumen to make sure that yes, we treat the patient for the diagnosis that you think is most probable, but you do also the right test to rule out the other differential diagnosis.
And Dr. Tarang, I know you're stressed with time, but before I let you go, can you elaborate on the slogan, get it right, make it safe? What does this mean? And what would be your take home message on this Patient Safety Day?
So I think when we say get it right and make it safe, we it is basically a call by World Health Organization to all the healthcare providers across the entire care continuum to have concerted efforts for significantly reducing the diagnostic errors through a multifaceted interventions rooted in systems thinking, as well as to ensure that we have minimized the human factor and we have active engagement of patients and families and healthcare workers and healthcare leaders across. And why this is important is because, as they say, do the anything that you do right the first time makes the maximum difference. Likewise, if we get the diagnosis right, then we have already made the care delivery significantly safe for the patient, because we will not make an error on something which will make us to give the wrong treatment to the patient and lead to a poor outcome for the patient. So that's why I think it's most important to get it right in the first time by diagnosing the problem properly, by integrating the whole piece of history taking, examination, diagnostic test, comparing the test, coming with differential, ruling out each of the differentials, coming out with the final diagnosis, and giving the right treatment to the patient, and then integrate the patient and the family in the whole process. From my side, I think the most important take home message which I have is that we have to ensure that improving diagnosis for the patient requires teamwork, good communication, and a systems approach. It cannot be achieved without a systems approach. And if I was to give a message, I would say, in order to get it right and make it safe, we need to coordinate, integrate, and communicate within the healthcare sector amongst the not only the healthcare professionals, but with the patient, the family, the caregivers, and also the healthcare providers.
I totally agree with you, Dr. Tarang. It is collaboration is the key word, between the practitioner, the surgeon, as well as the person who's responsible for diagnosis. It has to be correct. It has to be timely. And, on this special day, with the conversation that I've had with you, I also would like to take this opportunity to create an awareness for early screening so that you could diagnose the problem so that you're able to treat it on time. So, Dr. Tarang, thank you so much for speaking to us on BW Healthcare World. It has been such a pleasure. Thank you so much.
Thank you. Thank you very much. Thanks a lot.